Dr. Tutula Singata, the hashtag Kiredi Movement Doctor in the Gauteng region, now joins us to discuss this further. Great pleasure to have you in studio, Doctor.
Thank you so much for having me.
All right, let's start here then. We see there being, almost less focus on HIV/AIDS. Certainly after the COVID-19 pandemic and during the COVID-19 pandemic, that became the focus and certainly removed a lot of focus from, HIV and AIDS. How do we bring that back, and not just as we commemorate World AIDS Day today, not it just being something that we focus on and speak about on the 1st of December?
Okay. I really love that you mentioned that with COVID-19, because there was less of a focus on all the other communicable diseases like HIV, they sort of in the background were on a rise, and I appreciate that days like World AIDS Day bring us back to actually concentrate on the fact that these are issues that are still plaguing the country and that are rising, behind our backs. I honestly think that we need to go back to the basics. We were in a crisis in the times of COVID, but that crisis period is over. We need to go back to the basics, our campaigns, more television, because we need to make the public aware of what is happening. Yeah,
and we have obviously made some inroads. I mean, there have been some improvements. Just this week we heard the report speaking about where we are in terms of HIV and AIDS in the country. And we hear that, the rates of infections have indeed dropped on a general basis. And we'll talk about young women and why they're becoming a focus at the moment. But let's talk about some of the inroads and, you being, one of the people that I suppose are in the front lines when dealing with HIV and AIDS. Let's talk about the improvements and the inroads that we've made. We've certainly seen there are indeed some improvements.
Yes, I'm actually very proud of the progress that we've done. If you look at where we come from with HIV from the late 90s, early 2000s to where we are, so many of the interventions that were introduced are quite responsible for us being able to virally suppress the people with living HIV to ensure that they're living healthy lives. Promotion of the use of condoms, the developments that have happened with antiretrovirals. If you remember, it was a stack of tablets before, lots of side effects, and now it's just one tablet that people take at night with very little side effects. And then with the wonderful introduction of PrEP, that is a great measure to prevent HIV infection in people that are HIV negative, and post-exposure prophylaxis, which is taken by people that might have been exposed to HIV. Those public health measures have done wonderful in terms of reducing the spread, as well as suppressing the viral loads of those living with HIV so that they live healthy lives.
Yeah, what was disappointing though in the report is, when we speak about young women and how the infection rate there is actually increasing. And I think it was particularly the focus was on 15 to 24-year-olds, and that's where it's very problematic. How do we reach out to this particular, cohort of young girls and to say, to practice safe sex, to also abstain if they can or whatever? Some of them are also, I understand, having transactional sex. Some of them, it's a poverty issue. There's a lot that is, linked to why young women between this age group are, being infected the way that they are. How do we reach out to them and get to them?
Okay, so I just want this what we're talking about now takes me back to the World AIDS Day theme for last year, which was equalize, and the biggest focus of that theme was on the power dynamics that are tilted or not equal when it comes to gender and the relationships that men have with women.
Right.
So because of that inequality, because of the patriarchy, because of gender pay gaps that are very skewed more towards males, unfortunately. Women find themselves more prone to these transactional relationships and not being able to negotiate proper safe sex practices for themselves, or even negotiate consent in these relationships. So I think it's not just to focus on just the women and just the young girls, because a lot of the times these are minors, these are young girls, but I think the general focus should be on the older men that will unfortunately prey on these young girls.
But also, I mean, it becomes a criminal issue, doesn't it? It becomes a legal issue. I think one of the MEC was talking about there, the fact that, we can't just sit back. I mean, you've got 15-year-olds, being exploited, and they shouldn't even be near these men to begin with.
Absolutely. These are children. And I think when we blame or shame children who are actually victims in what's happening, then, we further sort of isolate them and push them towards, those abusive situations. But I also think that, it's not just a personal or individual issue where you and I can solve that problem. It's a bigger issue. It's a policy issue. It's a government issue. We need to empower women, and we need to create a space in society where women can be equals and thrive, and not be second-class citizens.
Yeah, I see that this year's theme is focused more on community coming together to assist. When it comes to the HIV and AIDS crisis. And I wonder if we can actually, in fact, I've said crisis by mistake, if we can still call it a crisis. But let's talk to the theme and whether or not we can still call it a crisis.
I absolutely love this year's theme because I feel like the project that #GeReady is a project that involves the community, encourages community participation, and works at community level. So I think I'll make an example of us to draw or explain the idea. So we have mobile clinics in communities that have poor access to healthcare, and we provide them with comprehensive health services, but more importantly, HIV testing, screening, HIV, ARVs, as well as PrEP. And that's what it is. You have to go to the root and involve communities and make sure that they participate in getting these services. I definitely do think it's still a crisis because we still have about 7.8 million people living with HIV in our country. And there is a concern about new infections, especially in that population of 15s to 22-year-olds, I think. So I definitely do think it's a crisis, especially for something now that is quite preventable.
And in some of these communities that you work with, do you find that there's still, that stigma attached to HIV and AIDS? I would assume it's not as bad as it was, say, in the 1990s and early 2000s. But, what are you finding as you work in these particular communities?
I think I would say it's a 50-50.
Okay.
So we encounter patients who will gladly say I'm HIV positive, I'm on my ARVs, I take them regularly. People, the attitude that people with HIV have towards their ARVs and their medication and their health is quite positive, and that's such a huge achievement. But there's also quite a huge stigma, especially with young people who just don't want to confront the issue by going to test or taking PrEP or using condoms. So that's still a big issue.
I mean, I like the fact that, we talk about, communities getting involved, but again, just in relation to the communities that you work in, the young people find it difficult to talk to, umama about, sex, sexual health, HIV and AIDS. How do we turn that around, in our own, Black communities where, one is able to have those kind of discussions and engagements, with parents? Because, if you're not getting taught, how to take care of yourself in the home, you're learning certain things outside of the home. And that's why perhaps we find ourselves being faced with the crises that we have when it comes to HIV and AIDS.
I think to normalize something like that, to normalize parents being comfortable talking to their children about these things, it's going to have to be an ongoing conversation. We can't have that conversation just once because it's World AIDS Day today. But also, we have created a WhatsApp line that is anonymous, that young people can use to reach out to us and speak to a doctor anonymously. So it will be me, it will be one of the other GeReady doctors, and you can ask us anything that is related to anything about your health. And there are no taboos, no jargon, no judgment. And so that initiative or that platform that we've created was because of the need that we see in young people not being able to have these conversations in responsible environments. Because if you do not have proper conversations or these conversations with your children about HIV, sex, and so forth, they will have those conversations.
Yeah.
And
correct.
it might be in the worst possible environment, under the worst possible influences.
All right, Dr. Singata, as we wrap up our conversation, then talk to us about what your message is today as we do commemorate World AIDS Day.
Okay, thank you so much. I just want to encourage everyone to please take responsibility of their health. Get that HIV test. If you test positive, there's medication. I always say that living with HIV these days is so different. It's like having high blood pressure.
Yeah.
Take your medication, you're healthy. If you find that you're HIV negative, continue practicing safe health practices. I also want to urge them to contact us on our WhatsApp line, 0600190000. We are also on social media at Giredi SA on Facebook, Twitter, Instagram, I think X now, Twitter's X.
Yes.
And we are on TikTok as well. And we do TikTok lives where we engage with our audiences to talk about any health topics that they would want to discuss.
It was such a pleasure having you in studio with us, Dr. Tutula Singata from the hashtag Giredi Movement, a doctor in the Gauteng region, talking to us, of course, on the back of us commemorating World AIDS Day, it being the 1st of December. We're going to take a break. More news coming up after this.